Good morning. Today we are going to discuss about the bones of the upper limb. Upper limb, and it is a very skillful organ, and the human being while developing, he developed the skillful movement, holding the instruments, and with the help of the instruments he may do the work. And there is a fine arts like writing and so many other things, and we may do with the upper limb and with the hands and fingers and palm. So these upper limb bones are scapula, and partially there is a sternum, and there is a humerus, it is a arm bone, and there is a radius and ulna. These bones are present in the forearm, and carpal bones, they are present in the lower aspect of the radius and ulna, and metacarpal bones and phalangeal bones. And about these bones and we may discuss. So here upper limb, with the help of the so many muscles, and that is attached to the superior lateral aspect of the trunk. Superior lateral aspect. So with and there is and three group muscles are there. Anterior group muscles, and posterior group muscles, and there is a lateral group muscles. The anteriorly upper limb is attached to the trunk with the help of the subclavius muscle, pectoralis major, that is in the superficial, and deeper than that, and there is a pectoralis minor muscle is there. In the lateral aspect, and there is a serratus anterior. Serratus anterior is located in this region, and there is a pectoralis, the deltoid muscle, that is comes under the lateral aspect of the upper limb. In the back side, there is a teres major, lateral aspect, teres major, teres minor, and latissimus dorsi. And in the medial side, and there is a levator scapula muscle, rhomboides minor, rhomboides major, and these with the help and the supraspinatus and infraspinatus, and with the help of these muscles and upper limb, that is attached to the superior lateral aspect of the trunk. So today, and we are going to discuss about the scapula. Scapula is a triangular in shape. Triangular in the sense, and this is a coracoid process of the scapula. Coracoid process. It is a coracoid process, and here it is a suprascapular notch, and it is a upper border of the scapula, and from here, and this one is a medial border, and here it is a glenoid cavity. It is a glenoid cavity. And with this scapula, with the help of this head of the humerus, and that is articulates with the scapula in the glenoid cavity. This one is a head of the humerus. So here, what I have to say, this is the upper border of the scapula. This one is a medial border of the scapula. This one is a lateral border of the scapula. So here, and this head of the humerus, and it is having the articular surface, and this articular surface, it articulates with the glenoid cavity. It articulates with the glenoid cavity, form a shoulder joint. So in a bone representation, this is the upper border of the scapula, and this is the coracoid process, and this is the acromion process, and this is the body of the scapula, and this one is a glenoid cavity. So here it has a three borders, and this one is the upper border, this is a medial border of the scapula, and this one is a lateral border of the scapula. It has a three angles. This is a superior medial angle, this one is a superior lateral angle, and this one is a inferior angle. And before this, before the description of the scapula, and we have to discuss about the side determination, because it is belongs to which side of the scapula and which side of the body. So this scapula, it is placed in the dorsal aspect and superior lateral aspect of the trunk in the back side. So scapula is a triangular in shape, and it has a costal surface or anterior surface or ventral surface or costal surface. In the back side it is a dorsal surface. So this articular facet is a glenoid cavity. So in a side determination, the lateral border or medial border of the scapula, it is a sharp, and the lateral border of the scapula, it is a blunt, and it is a rough. The costal surface, it bears the rib impressions. Rib impressions, they never present in the dorsal surface, because this costal surface is in front of the costal surface, and there is a thoracic cage is there. In the outer surface of the ribs, they are related with the costal surface of the scapula, and the back side, and it bears the spinous process. Suppose because of these points, and this scapula belongs to the left side. Suppose if you bring in a right side, and the spine, it has to present in the back side, but it is coming in the front, so it is not belongs to the right side. So costal surface, and it is going towards the back side, so it is not belongs to the right side. And once again, this side determination in practical, it is a very important. And here I am saying, and this one, the coracoid process, it is projected anteriorly. One, the glenoid cavity, and it faces towards the lateral side. Costal surface, it is having the impressions of the ribs, and the dorsal surface or back surface or posterior surface, it bears the spinous process, and inferior angle, it is directed downwards, so it belongs to the left side bone. It is a left scapula. Then we have to discuss about the borders. This is the upper border. Upper border, and it begins medial to the coracoid process of the scapula, and medial to the glenoid cavity of the scapula. So this upper border, after beginning, there is a notch is there. This notch is called by the suprascapular notch. So this suprascapular notch is converted into the suprascapular foramen. The suprascapular notch converted into the suprascapular foramen here, converted into the suprascapular foramen by the transverse ligament of the scapula. So this transverse ligament of the scapula, it has two ends. The transverse ligament of the scapula. The transverse ligament of the scapula, it has two ends. In this figure, this side is a lateral and this side is a medial. And this suprascapular is converted into the suprascapular foramen by the transverse ligament. This one is a transverse ligament of the scapula. So above the transverse ligament of the scapula, above the transverse ligament, here there is a suprascapular artery is there. This is the suprascapular artery. And this suprascapular artery, it is a branch of the axillary artery superior to the transverse ligament and superior to the suprascapular foramen, and it enters into the dorsal surface of the scapula. But in the beginning, it is located in the ventral surface of the scapula. And at this region here, and there is a nerve is there, and that is called by the suprascapular nerve. So suprascapular nerve is present inferior to the transverse ligament of the scapula, and superior to the transverse ligament of the scapula there is a suprascapular artery. So this point you have to remember. It's a very important. And in some books, and it is described in different, but actually in the body, and we may find, and superior to this transverse ligament of the scapula, and there is a suprascapular artery is there, and the suprascapular nerve, and it is located inferior to this transverse ligament of the scapula. Being this suprascapular nerve, and it passes from anterior into the posterior surface or dorsal surface of the scapula through this transverse suprascapular foramen. Then it enters into this supraspinous fossa or supraspinal. Yeah. And here there is a muscle is there that is called by